Hi, I'm Dr. Mark Perloe, and we're here with GRS Facebook Live with Rachel Brandeis. Rachel is a registered dietitian and nutritionist who has worked with many of our patients with PCOS over the last few years. And I've come to rely on you for helping those patients make the dietary changes they need to help them get pregnant. Sometimes it's actually just tuning things up rather than high-tech fertility that provides the solution or the outcome that they're looking for. So how did you get interested in PCOS as specializing in nutritional aspects of that and working with these women?
Well, I mean, I think the earliest time I heard about PCOS was when I think I met you years ago at Northside Hospital, and you asked me if I could help you with your PCOS patients, and I really didn't know much about it. That was, I think, 20 years ago or 15 years ago. And what was fascinating to me after I researched and educated myself is what an impact diet can make in these women, especially their fertility, and to help them be healthier and be able to get pregnant and decrease their risk of diabetes and live a healthier life. That was something that was impactful to me because I could make a difference just by helping them change their diet and their lifestyle.
So many of the women who come in say to me that I eat healthy. And I don't have to worry about that. Just give me the medicine. How do you go about evaluating the dietary choices that people are making? And what kinds of things do you find when someone says, my diet is great, and in looking you say, well, maybe not. Here are some changes you can make. But how do you go about that?
I think it's all about perspective. And I don't think anyone eats wrongly. I think that you need to figure out the best way to eat for you given your medical circumstances or given why you are seeking treatment. And I always try to put it in context of, with PCOS, it's a multifactorial approach. The treatment modality, yes, it's medication and it's the genius stuff that you can do with them, but also diet and exercise play a role in it as well. I mean, it's like that three-legged stool we talk about all the time. If one of those legs are gone, the stool falls over, then you're not getting the best treatment. So by adding the diet and the exercise in addition to all the other stuff that they're working with you on, you're getting that full treatment.
Well, there's a tendency, and I don't know how you address this, that when you're on metformin, maybe you can cheat from the diet. So, well, at least I'm on metformin. At least I'm
Correct.
taking Ovulation.
Right.
And I'm doing all the other stuff I'm supposed to do. So maybe I can cheat and make those choices. Have you seen that?
Sure, and I think cheating is a relative term,
yeah.
and if someone would come to see me, I would never tell them they can't eat their favorite foods. It's just, it really is embracing it in your head. I think a lot of people, I would say most people, know what healthy food choices are. It's the bridging the gap between knowledge and action. And you have to bridge that gap. And it's not about deprivation. It's not about being on a diet. It's eating the best that you can for your specific outcome, whether it's diabetes reduction, whether it's weight loss, whether it's fertility. It's putting it all together and looking at it as a healthy way to live as opposed to being deprived, or I have to stay on this diet, or I can't eat this, or I can't drink, I can't do this.
I think the perfect example that was an experience that I had was when I went to a course on nutrition, luckily at Culinary Institutes of America in Napa. And at that time, we participated in cooking. We did lectures, and we had food tastings. And I left each day so full and so satiated by eating wonderful food that I was afraid when I went home on all the weight I would gain. And in fact, I lost 4 pounds. So I think you brought up a really important point, that this is not about depriving yourself. It's not about starving until it hurts. It's about making those healthy choices. One of the things we did was actually get involved in the food preparation, even as much as going to farmers market, getting to meet the farmers who were growing the food and hearing the stories. So living inside your head was the story about the food. It was a process. It was not, oh my God, I'm hungry. Maybe I stop at McDonald's because I don't have a lot of time. I need to put something in there. Getting away from that mode into celebrating the food that you prepare and eat, I think is one trick that helped me get a hold and make some more healthy changes in my diet.
And you went to the source, and then you feel good about eating from the source, and you prepared your own foods. And I think so many women with PCOS who come to see me have dieted for so long. They have tried everything. They have deprived themselves. They've gone on super low carb. They've gone on paleo. They've gone on every restrictive diet without seeing success. And I think the focus needs to be on how can you make specific dietary changes that you can stick to, that are impactful, that work. And what people have to understand is that these diet books out there, they are for the masses. They are not for you as an individual. And when you lock on to something that is for the masses and you're trying to follow it to the T, it's very hard to sustain that. And it's not something that you incorporate forever. And these changes that you make when you have PCOS, you want to make them for a lifetime. You want to incorporate changes that are easy to follow, that you can live with.
So one of the things that I've heard some of the patients coming back and talking about was that you have a tool or app that they can use to help them get a better handle on what they're doing and where they might make changes. Can you speak a bit about that?
Yeah, this is a new tool that I use that I think is impactful with behavior change, because that's what we're talking about. And it's called Healthy, and it actually allows patients to do photo food journaling. So all they do before they eat, it just goes right to the app and takes a picture, and it comes right to my feed. It's like a Facebook feed. And so they get real-time comments from me. Coaching, it's online coaching, and I would never tell them if they're going to have a delicious meal that doesn't look so good. I would never say, don't eat it, don't eat it. I would, but again, it's an opportunity to say, okay, this was your meal. How could you have changed that to make it better for you? Or that was perfect. Let's repeat that. So it's real time. Well,
I think getting that positive feedback is also helpful and motivating, that when you know something is a healthy choice, and then ultimately you see the feedback that you feel better or you start to gradually lose weight. So when someone corrects their diet, do you have a sense, well, I'm not losing weight, I just lost 2 pounds last week, and that's it, and I expected to do more. What kind of expectations, if all things are humming correctly, what's safe weight loss?
Well, I also think in terms of a PCOS perspective, it's more than just weight loss. It's ovulation is, happening. Their cycles are more regular. Any type of weight loss. Maybe they don't lose weight, but you're building more muscle mass. I mean, that's progress. And I think going into this, by changing your eating patterns, you will lose weight, you will increase your lean muscle mass, and you'll feel better. Your energy level will be better. The fatigue will be better. So I think those are important parameters as well.
So if you're a patient of mine, you probably heard this story about the subway station in Beijing, where things were crowded, early morning rush hour, people standing on the platform, and the train pulls in and it's filled. The doors open and people start pushing in, and I said to my son that that's exactly like insulin resistance in PCOS, because the muscles are filled, there's no more room. Insulin goes up trying to compensate, but it doesn't work out, and those carbs get turned into cholesterol and fat. So it's an interesting analogy, and it also provides ideas about the solution, which is put more cars on the train or build muscle, and to do some aerobics to actually make some room in the cars and use up some of the stored fat and glycogen inside the cells. So I think that's a good model to help understand. But the building muscle is an amazing tool to help people lose weight. And we're hearing about that, and maybe that shift to making sure that their strength training is part of this. Can you speak to why building muscle may be an important part of any attempt to lose weight and manage PCOS?
I would say you hit the nail on the head with that. As women in particular, we are programmed to be cardio queens. That's what I call
Yes,
us,
exactly.
cardio queens. That we don't feel like we've exercised unless we are on a machine and we are sweating profusely and your heart rate is going up, up, up. But just to what you said, you want to elevate your metabolism. If your metabolism is elevated, you burn calories more efficiently. Thus, you will be able to lose weight more efficiently. How do you do that? You need to build muscle mass. It's the only way you can increase your metabolic rate. And how do you increase muscle mass? That's through strength training. So we always talk about in consult with the patients that you refer to me is that you need to get off the cardio and you need to get in the gym and start lifting weights. And and I get feedback all the time, well, my testosterone levels are elevated, I'm going to bulk up, I'm going to be huge. You're not going to be huge. You are going to be lean. And that's what you're going for. The only way to increase metabolism, I will say it again, is through increasing your lean muscle mass. You cannot eat anything to raise your lean muscle mass. You have to train. You have to do weight training.
So it's interesting. I didn't realize this at first, that a pound of fat is going to burn about 3 calories a day, and a pound of muscle is going to burn 75 calories a day.
Right.
So I'm not sure on my math here, but you can gain about a pound a week with good strength training programs. So after a while, you could be losing a pound or two a week, just based on having put on 6 to 8 pounds of muscle mass.
But if you're putting on muscle mass,
Yeah.
your body fat is going
Right,
down.
exactly.
So that's the key here, is that you want to be leaner. So with PCOS, you want to be in the gym doing strength training. What I always tell people is you want to hit your major muscle groups at least twice a week.
Well, actually, I'm a little bit.
Okay.
Okay, so we do find something we don't agree on here. There was a great study out of McGill University, and they did one group with pure aerobics daily and another group once or twice a week with strength training. So I like that idea of just once or twice a week. It sounded pretty good to me. So I started to go out and buy all these college exercise physiology books. And what at first, when you do this, you're going to end up with a lot of muscle inflammation, and you're going to be sore. And after about 4 to 6 weeks, that becomes less of an issue. But there's inflammation in the muscle, and what these people have found is that if you want to increase strength, working out a muscle group once a week is sufficient. So I usually advise people pick one session upper body, one session lower, and then if you want to do a third session, do core strength exercises.
Absolutely.
And that gives the muscle a chance to heal
To rest.
between, and that rest allows you to increase muscle mass. If you're doing 3 or 4 days a week on the same group of
Correct.
muscles, you may not really be
Agreed.
building
You
muscle.
need the rest in between. And I'm thrilled just when patients take that advice and do strength training, because again, as females, for some reason, we're so programmed to just think that cardio is all we need to do. And as we age, we lose muscle mass. I mean, sarcopenia happens, and
2% a year,
I know it's
unfortunately.
scary. It's
Yeah.
scary. But if you can combine the weight training and change your diet in a way that can be helpful with PCOS, those are the lifestyle changes that need to be made.
So, 2 areas we hear at, and I'll mention them both now and answer them as you like. One is you hear the term low glycemic all the time, and if you could explain that. And then the next one is we hear that people or women with PCOS have a lot of inflammation.
Yes.
And the question is whether diet is causing inflammation, which is making them insulin resistant, or the insulin resistance PCO situation is making them have more inflammation itself. Which came first?
Correct.
And then how might we address it? So I'll let you start with those.
Okay, so with the glycemic index, that is based on a single food. It's based on a piece of white bread in a test tube, how much it elevates your blood sugar. And I always tell patients that we don't eat based on the glycemic index. Very rarely would you ever have just a piece of white bread for breakfast, or just a plain cup of pasta for lunch, or just a plain potato. So the glycemic index can be a tool, but you have to understand that once you add fats, once you add protein to that carbohydrate, it changes the glycemic response.
And then also how you cook it.
And how you cook it. Correct. Agreed.
Yeah, pasta al dente.
Correct. Has a lower glycemic response
than overcooked. Yeah.
So I think eating towards an index is not something that is sustainable nor realistic, but think about how you combine your food. Think about when you have a carbohydrate, how can I reduce that spike? By adding lean protein, by adding healthy fats. That's what helps.
So a little bit of olive oil sprinkled on top is going to slow the absorption and maybe cut down on inflammation.
But then
too.
adding a half of avocado on top of that and making a slice of avocado toast with a little olive oil, then you've got the trifecta there. So that would be fabulous.
Okay. I'll have the avocado probably without the toast.
Okay, that's fine. But I think the key take-home point here is that you don't have to not eat carbohydrates. Right. Carbohydrates are needed. We need it for energy. It's the only macronutrient that crosses the blood-brain barrier. You need it to function, to have energy, and to think clearly. But you need to be, I would say, selective about the types of carbs you eat. And they need to be what I call carbs that are useful. You want to try to avoid those refined, garbagey carbs that just taste good going in the mouth, but then they're gone.
So you brought up an interesting point about thinking and needing the carbs for your brain. With very high insulin levels, oftentimes a lot of the carbs will be stored before they get up there.
Correct.
And people get hypoglycemia, which is going to cause craving and really a foggy brain.
I hear that all the time.
And then I hear all the time, well, you know, I went to Rachel, I've got on this, I've got on the Avasitol and metformin, and the brain fog seems to have gone away. They get pregnant, and their docs are not feeling comfortable putting them back on that approach if they're not trying to get pregnant, but the patients are saying, you know, I feel different. I'm a whole lot better now, just from a day-to-day basis.
But I thought your interesting point was, and what I've learned from you especially, is that PCOS, it's, yes, when you're trying to get pregnant, you're in treatment, you're compliant because you want to have a baby, but PCOS doesn't go away. It's, you know, it's something that you're dealing with for the life cycle. So your dietary changes that you do at one point, you don't want to stop. You want to continue this this is how you need to be eating. If you have PCOS, you have insulin resistance, you want to be eating in a proactive way so you don't go back to the brain fog.
Yes,
you don't go back to the weight gain. You don't go back to the higher levels of fat to lean mass in your body.
Okay, let's go back now to the second half of that question about the inflammation.
Yes.
What is that all about, and what's an anti-inflammatory diet, and should we be looking at that?
So I would say the best way to approach your food is to look at colors. The more produce you have in your life, the more natural those antioxidants are going to be. Those are your non-starchy vegetables, your fruits that are not super high in sugars. You need to make sure produce is a part of your life because that's where you get your antioxidants. It's from the ground, it's from the earth, and it's not in a pill because it's synergistic. It's the whole fruit, it's the whole vegetable. It's how it's prepared, that you're not killing the produce with lots of bad fats or cooking it to death. Or so I think from an antioxidant perspective, if you look at a PCOS diet in total and you're focusing on lean meats, not too much red meat, you're focusing on the healthy fats, monounsaturated, polyunsaturated, you're focusing on non-starchy produce, brightly colored foods, nuts, seeds, those are all anti-inflammatory. It doesn't have to be complicated. I think people make it more complicated than it should be. Eating shouldn't be complicated because we have to eat all the time. So once it becomes complicated or once it becomes too measured and too balancing and
we're not going to do it. It's not something, it's not sustainable.
No,
right, exactly.
Who has time? So I think going back to even your point as what's a healthy weight loss, when patients come in to see me, I'm the first to say, how do you feel? How's your energy level? Are you feeling better? If you are losing weight, any kind of weight, that's progress, because so many women with insulin resistance or PCOS never see the scale go down. All they see is the scale go up. So to think that you're going to lose 10 to 15 pounds in a month, we need to reposition your thinking.
Two other diets that we hear about are the ketosis, well, a couple of diets. One is ketosis diet, one is the HCG diet,
yes,
and then the other is paleo.
Yes.
And if you could maybe comment some on each of those.
Well, I think it's interesting how keto has become a big buzzword now, these ketogenic diets, meaning very high in fat, very low in produce, very high in protein, very low in carbs. And if you look at the keto diet, it is an inflammatory way of eating. And with PCOS, you don't want to increase your inflammation. You don't want to be in a ketotic state. I mean, that's a negative metabolic state. And paleo takes part of it. Paleo, they eliminate lots of food groups. You're eliminating dairy. You're eliminating grains. And the HCG diet. Any of these diets will work in the short term. They will. But if your diet is causing your inflammatory markers to elevate, if you are feeling tired, if you are not thinking clearly, if you have no energy to exercise, if that is not something you can sustain, then my question is why? And I know the quick fix is important to people and they want to see results very quickly, but PCOS doesn't go away. It's something you manage, and I think it's important to find a way to eat that you can manage it for long term.
In regards to the HCG diet, there are two side effects. One, it predominantly works by significantly lowering calories, and compared to a low-calorie diet without that, there really is no difference by adding the HCG. But the net result has been that there's been a real shortage of HCG for people who need HCG for their fertility treatment, and the cost of it is now probably 3 or 4 times what the cost of HCG was a couple of years ago before this diet got out there. And there's just no evidence that it does anything in addition to cutting calories, which really, again, is not sustainable.
Correct.
I think that's a big point that you brought up, is that making changes to get the weight off, but then going back after you've got that weight off, it's not sustainable. And changes ought to be looked at as, what can I do that's sustainable and that I'm going to stick with?
Well, and you also see about the long-term effects of weight cycling. You don't want to be going up and down with your weight. My goal for anybody who comes to see me is to help figure out what will work for them for the long term, that's sustainable, that they see the results. And it will take a long time. It's not something that just happens in 2 weeks, in a month. It takes time.
Do you have a sense or any tips, when you're looking at what someone's eating, you might consider trying this instead? Do you have some things that you might share with us?
Well, there's so many new products out in the market, just like we were talking before, like to get in more produce instead of more carbs on your plate, more produce on your plate, like the cauliflower rice, the packaged salads. Those produce items that are pre-prepared, that are easy to incorporate, the frozen food aisle now is full of them. They have frozen food with the vegetables that are already prepared. Even if they're a little sauced, it's fine. Frozen is just as healthy as fresh because they're harvested right at the time of when they're frozen at the time of harvest. I think going into the produce aisle, going into the frozen food aisle, it's important because that's where you're going to find your produce. That is where you're going to find your produce. And that's key because so many people don't get in enough of the non-starchy produce. And using the convenience of it, like those salad kits, I think are fabulous.
Well, you got us hooked on that. So
the
that's
sweet
something,
kale salad.
The sweet kale salad and love taking a chicken breast and cutting it up or throwing some extra pistachios on it.
But it doesn't have to be hard.
No, it isn't.
It
It's
doesn't
just
have to be hard.
No, it isn't, and it's a great way to prepare that lunch. I know for many of us, lunch is a meal that you don't think about in the morning. You don't want to think about that.
You're just trying to get it in.
You're just trying to get in, and then you get here at lunchtime, and it's like, okay, where's their food? So want to thank all those people who are watching here. On the bottom of your screen, it will ask if you wish to subscribe. If you want to subscribe to these, we do these broadcasts once a month, and this month we're celebrating PCOS Awareness Month, and it's a good time to get more information. There are a lot of activities going on throughout the remainder of the month now, and but you can subscribe to this broadcast, and you'll get an announcement a day or so before when the next one is going to be live. If you'd like to send in a question for us, we'd be glad to answer any questions that you have. How do we contact you? What's the best way for people?
Through my website, just
Okay.
rachelrd.com, and I'm happy to answer any questions anybody has, to be a resource. I think the most important thing with the diet component of PCOS is where you get your information. And it's important that you find someone you can work with that is basing their recommendation on scientific evidence as opposed to anecdotal information, and understanding that the diet aspect of this should be tailored to you personally. It is not just a paper form that you can just follow this and good luck. You want someone who will take into account how you cook, how often you grocery shop, what do you like to eat, what don't you like to eat. You don't want to be pigeonholed.
It's definitely not a one-size-fits-all approach.
No, it's not.
I think people also probably want to know, does insurance ever cover this kind of treatment?
It depends. It depends on who your insurance provider is, and I think it varies state by state. I've had luck with insurance covering, but it depends, unfortunately.
Okay. And this information is really about building that relationship and developing that sense of trust with someone who's going to take the time to understand and know you. Does someone have to be in Atlanta? Have you done Skype consults?
I do, through this Healthy platform that I use. It's on a HIPAA-compliant Skype platform, so I do all types of virtual consults and all of that good stuff. But I think the key is finding a practitioner who knows PCOS, who's not going to hand you a diabetes meal plan, which is what a lot of people come to me and they're like, well, I was given a diabetic diet. Yeah. Well, you're not diabetic, so why do you need to do that? So I think it's finding, just like it is finding a good doctor, you want to feel comfortable and you want to be able to feel like they know where you're coming from a diagnosis standpoint.
So that's an interesting point when you mentioned diabetic diets. At first, when we were first trying to look at PCOS, a lot of the referrals would end up with that handout for the type 1 diabetes diet, and that's a totally different situation than we're facing with in people who have type 2 diabetes. Can you maybe just briefly say why the dietary approaches or nutritional approach is different?
Well, in terms of if you are a diabetic and you're dependent on insulin, it benefits you to count carbohydrates, to be very strict as to counting carbohydrates. And that is something that you have to be aware of every time you eat. So with PCOS, you want to moderate your carbohydrates. You want to add good fats. You want to add good protein. You're not beholden to a meter in terms of reading your blood sugars before you eat. You're not beholden to an insulin dosage. So it's different. I wouldn't say it's more liberalized. Well, it is more liberalized. You're not having to count carbohydrates and to account for them at every single meal.
But I think it's also worrying as much or being concerned about how this might affect insulin, which is responsible for some of the complications we see with type 2 diabetes.
Correct.
Where type 1 diabetes is primarily looking at the blood sugar levels. So want to thank you for tuning in. That's the end of our half hour here. Time went really fast. And I'm sure we'll have questions that may not have been covered in this talk. So if you would like to post your question in the comment, I'll share them with Rachel or send them around an answer back to you, and we'll see what we can do to help you with that. Remember, please subscribe and look for our next broadcast next month. Thank you so much.